the more that we wait, we lose penile length in general. So a man can lose between 0.5 to 5 centimeters in penile length for every year they're waiting to get like any treatments of erectile dysfunction.
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the informed side of care. Welcome to Baptist Health Talk.
I'm your host, Willard Shepard. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're talking about erectile dysfunction, where we'll explore the causes, symptoms, and how to support a man dealing with this. We are joined by Dr. Juan Cedeño, a urologist at Baptist Health, and thank you for being here.
Thank you.
First of all, I wanted to ask you about this particular topic and how sensitive it is. Sometimes it's so much misunderstood. What are some of the common myths?
So one of the most common myths that I receive in my office is like, when I ask the patient about their erections, they just said like, oh, I'm getting old. And the reality is not like an old man's problem. It's a problem in general, same way as like high blood pressure, high blood sugar, cardiovascular conditions in general. The only problem is we've been like trained, throughout the life that this is an old man's problem. That is not. In the same way, medicine has focused to increase the lifespan of a patient. The only reason why we should go and get to those years, all right, is to increase our like sex span and things that we enjoy, like playing golf and like encourage to have like a good relationship with our like significant others. That's part of like human beings. So we should continue doing it.
Tell me, many times people think this isn't dangerous, but it could be an indication of other underlying health conditions. What about that?
So it is. Some of the time it's very rare, that happen that a patient comes to our office complaining about erectile dysfunction. And when we do the workup, we found that the patient has cardiovascular conditions like coronary artery disease, atherosclerosis, hypertension, diabetes, all of them. Right. But it happens. It's actually the reflex and the consequence of these medical conditions that affect our sex performance.
Now, in terms of testosterone, we hear a lot about that, but what role does that play with this?
So it does play a role. However, if you ask me, for example, if having low testosterone will affect my degree of erection, it does not much, but it does affect the libido. So if you don't have the libido in order to engage, you may not get a strong erection. However, it's a balance about everything. So it's very important to have your testosterone being checked.
Can this be reversed? And if so, how long does that take?
So reverse is very tricky, because the reality is not. However, you can treat it, right? You can basically prolong your sex span, as I said at the beginning, right? How? Just basically seeing a specialist, and that way you can get a proper form of treatment before it's too late.
Now, tell me about the timeline to do that, if you can, in essence, reverse this.
So, like at the beginning, let's say at the beginning of the condition, when your degree of erection is still, let's say, 9 out of 10, having a good, healthy lifestyle, it will help, because that way you can reduce the stress, you can reduce the cardiovascular conditions like diabetes, you can reduce obesity, you can increase your better sleep, and that way you can, maintain a steady erection. Then later on, we got medical treatment. That's when we going on the office.
Now, at the foundational level, what about the causes of this, the primary causes and the risk factors all of us should be aware of?
So one of the main risk factors is diabetes, all right? If you see the percentage of male who has erectile dysfunction, the vast majority of them are patients who has diabetes. The other big portion of the pie, it is patients who have cardiovascular condition, and this includes hypertension, atherosclerosis, and coronary artery disease. Very minimal patients, about 9% of them, are those who have pelvic injury or surgeries in the pelvic area, including colon cancer, rectal cancer, including prostate cancer or bladder cancer, right? Another least minority include psychological conditions as stress and other things.
You mentioned that important to me. I'm a person who has to watch my A1C, pre-diabetic, so I need to watch that. My dad was a late onset diabetic, so low carbohydrates, not much sugar intake, Lots of exercise.
That's-
And that'll move forward in a positive direction and reduce the risk.
Yeah, it will reduce the risk. However, I can tell you, like, there's certain degrees of erectile dysfunction stage, right? And a certain level, basically, you're gonna reach to, like, let's say stage 1, stage 2. The thing is how to promote not to get into stage 4. Okay, so that's how you doing.
Okay. Let's talk about the symptoms without stating the obvious. What
Mhm.
other things go along with that, and how can we recognize it?
So one of the things that happen and I see is when I like talking to the patient, they're like, they are not confronting the problem. All right. Basically, they're running away of the problem. And the way they did is like, oh, I'm not trying to engage much like sexual intercourses with my wife because I don't want to be embarrassed. So when you have those doubts in your mind, it's because there's a problem with it. And the best way is to go and address it. Like most of the men, okay, it takes about 4 to 7 years for a man to go and see a specialist and talk about this. So just imagine those 4 to 7 years that you're spending behind the shadows, right? Try to diminish yourself, saying like, oh, I'm tired. I don't want to do this. I don't want to engage this, or just once a week, maybe. So this is like what you need to do, right? So go to a specialist. That will help you.
You talked about those stages, but elaborate on that. And this is not something that happens overnight.
Yeah.
Go into that area, please, in detail so we can understand that.
Yeah. So the way the stage is being measured is by the firmness, okay, of the erection. Most of the time, when I talk to the patients on the office, I just tell them, hey, in a scale of 1 to 10, how strong they are. And they're like, oh, if they doubt it, I always go under the lower side. So, okay. So every time that you're able to or want to encourage a sexual intercourse, are you able to? And depends how many times they are able to. Second, like how firm you think it is, all right? And then the other thing that I ask is like, are you able to penetrate or not? Because one of the problems is sometimes you can get directions, but you're not be able to penetrate because it's too soft, all right? So that being said, based on that, what they're telling me is what I grade. So the grades are going from 1 to 4, meaning 1 is the least problematic, 4 is the most problematic, the less firm. So based on that is what I grade. But that doesn't affect much how's the treatment options, because among the treatment options that you get, you can play around based on what the patients want.
Mm-hmm. Now, is there anything that we can do to prevent this?
Yeah, pretty much it's health, all right? Health in general. So like you may need to do some exercise, regular activities, try to decrease the stress level that you're living. Also try to encourage a good and better sleep, because part of it, as we said, that testosterone reflects on the way that we increase our libido or not. So it's like crucial to have a good sleep in order to get good testosterone level. Also your nutritions, you have to increase your magnesium, your zinc, all right, and try to decrease the the carbohydrates as well as the fatty meals in order to prevent like hypertension, cardiovascular conditions. So if you want to resume this long answer, is just having a good lifestyle, pretty much healthy.
You touched on this a little bit before about people thinking this is simply in our older male population, but that's not the case.
No, it's actually not the case. Like if you see the statistic, like 1 in 5 male with age of 20, they have certain degrees of erectile dysfunction. The problem is just being behind by the shadows. If you're in my 20s and I go into the gym or a bar and I tell to my friends, hey, I'm having this issue, they probably laugh about it. And so that's one of the things that I always encourage to the patient, even though if they don't come to the clinic, not because of this, they're coming for something else, I ask about it because I know what they are feeling for. Now, if you are like 40 years old, right, like 50% of the 40-year-old male has this issue, 50%, 60%, 70% of them they will have. So it's a lot of male.
It's such a sensitive topic. You already talk about some people living in the shadows for a couple of years about this. We've talked about the physical part about this, but what about the emotional aspect of men who experience this?
So that's critical, right? Because every time I talking to the patients, when let's say I try to encourage them to talking about their erection, right? When I able to get some for a treatment, and when they coming back to see how's the follow up, the only thing I see from them is smile. The only thing I see from them is thank you. The only thing I receive from them is like hugs. It's like, thank you. You make my life back. And simple as that. And I was like, wow, that's great. So definitely there's a crucial psychological component. And if you look on the mental health conditions that we are living currently in our era, is depression one of them. And one of the subside of depression is not being able to enjoy life as it is. And part of like the sexual intercourse is part of life in general. So just imagine we're contributing to decrease that number. So it's crucial.
How can a partner support an individual who's dealing with this from an emotional perspective? How important are they in this recovery?
They're like, they're a big part of it. When I'm talking to the patients who are like on the, let's say on the, they need more treatment than just a pill. And I'm talking about like penile prosthesis, right? And they always say, oh, I need to talk to your partner. I said, bring it over. I want to talk to her. And when they are there and I talk to her, they are the person who actually encouraged them to go and do it. And some of them, after I do my surgeries or anything, and when I talk to the partner, I say like, oh, everything is done, went great. And they say like, oh, this is going to be so important for him because he's been depressed about this. So the partners are very crucial part because this is the person who we got next to our side in order to encourage to do everything, like working, life in general. And this is part of it. So they're crucial on this.
I imagine this is a thin line for a partner to walk where they want to encourage the individual, but not putting any pressure. Address that.
Correct. 100%. Like that's like a tough conversation, right? But I think it's more tougher to live and have that depression inside of you because you're not able to perform. And there's there's always a way to say, hey, we can do this, we can try this. Why we don't see a specialist? Why we don't talk this with your primary care doctor? And that can help us with. So definitely there's options.
Okay, for those people who, and this is a big chunk of the population, one of the main reasons we selected this topic and your expertise to get out today is what advice do you have for men who could feel embarrassed about coming forward, and why is it important not to wait?
So it is important not to wait, not only because there's treatment options and there's several of it, all right? It's important not to wait because here what we're dealing is like with your part of your psychological component as a human being, right? So it's going to be very important if you come and see a specialist right away, okay? Instead of waiting 4 to 7 years, all right? There's like data who says that the more that we wait, we lose penile length in general. Mm-hmm. So a man can lose between 0.5 to 5 centimeters in penile length for every year they're waiting to get like any treatment of erectile dysfunction. And this is because we lose the property of stretching. So it's a very important topic in general for the men to go and see a specialist, even try at the beginning with your primary care doctor, and then afterwards just moving forward on the ladder, all right?
Okay, clear up misconceptions. There's ads on TV about these types of things. People initially think, oh, I need to take some type of pill, that is the solution. First of all, address that portion of that type of treatment and oral medication.
So there is like pharmaceutical oral medication. When I'm saying like this, I'm talking about the general like sildenafil, tadalafil, vardenafil, right? Those are the ones created for erectile dysfunction. And there's other ones that is like the gas station pills, all right? There's been research studies done on those gas station pill, and they have insane amount of this medication, the pharmaceutical components, all right? And they sell it, let's say, like they're not the correct product, okay? Because you're getting too much of a product that can be dangerous for your health, all right? Mm-hmm. So most of those advertisements that you see in the clinic, those are like, I will say those are like a snake oil, right? They're not the actually medications that you need to. And if you're willing to get something from the gas station, right? The only thing that you can get there is the oil. pump, right? Like fuel, right? Why you don't see a specialist and like you can take advantage of like your insurance plans and like talk about that. And also there's other things that we can do for you.
Yeah. What about the other treatment options?
So in terms of treatment options, there is like something that it works for certain males, which is intracavernous injections. Let's say is like insulin needle that we inject in the area, all right, and that can give you a potent erection. There's suppositories that goes in the urethra, and there's also the surgical techniques that call inflatable penile prosthesis, which is a small procedure that takes in a specialist about less than an hour to perform, and this is something that it can allow you to regain the spontaneity or allow you to have an erection every time that you want for the time that you want. So the way I tell to the patient, this is the way that you can turn on at the spark in your room for your partner. And they're actually very motivated on doing it.
Well, it's been incredible. The big picture is a good overall healthy lifestyle with the proper diet, keeping your A1C in check, a good testosterone level, and just good healthy heart, things across the board can all have an impact on that. And great you're teaching us that, because I don't think many people realize that there is a direct connection and correlation to our overall health and this. Any final thoughts and advice for us?
No, my only advice is like if you are having just a slight problems with this, just go and see a specialist. Don't get like behind the shadows. Don't feel yourself bad about it. Okay, this is a regular problem. In the same way, it can be hypertension be fixed with taking a medicine. In the same way, diabetes taking a pill is just like the same thing happened with erectile dysfunction. At this point, it's just taking a pill. Don't feel yourself down because of this, because at the end, it's a problem that has a solution. So better to get in time and start working on and move forward.
Dr. Cedeño, thank you very much for our work in our community here at Baptist and beyond. And thank you for taking us into this area that many people feel uncomfortable talking about.
Thank you so much.
Great conversation, as you can see today, and thank you so much for what you've done to share this insight with our audience. Remember, viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thanks for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.